All right, so it's John here again. We're going to be moving on to the third part of our medical assessment. We're going to be performing our secondary assessment based on the chief complaint that we were provided. Now, in regards to this portion, we're going to obtain a sample history. We'll break this down right now. Now, understand that this portion of the assessment is more of a verbal assessment. This is all verbal assessment. You're going to have to ask your patient. Okay? Now, excuse me, within the first part, we have our S, which is our signs and symptoms. Our signs and symptoms. So the first part is going to be the onset. We're going to ask our patient, what were you doing when this illness started? Okay? So what were you doing when this illness started, and was it a gradual onset or was it a sudden onset? Remember, ask these questions separately. Don't overwhelm the patient. Ask them one at a time. What were you doing when this started, and was this a gradual or a sudden onset? As far as provocation and palliation, we're going to ask them, what makes this condition worse? So in regards to a chest pain patient, for example, if they walk or exert themselves, that can make the pain worse. So exertion. What makes that chest pain better? When I sit down and rest. That would be considered palliation. What makes it better? The quality. Now, when you ask the patient the quality of the pain or condition of how they're feeling, keep it open-ended. Let them answer that question. Don't ask a leading question. So, can you describe the pain to me? Let them tell you. Okay? Some answers would include it's a dull, sharp, cramping pain. It's a very sharp pain. Okay, there could be multiple answers with that. Okay, so just copy down whatever the patient tells you. Now for R, what region? What region of their body is in question? So if somebody's having chest pain, you're going to ask them, what part of your chest is hurting? Try not to ask them point exactly where. Just ask them, what part of your chest is hurting? And if they point to a general area at the center of their chest, okay. Now, from that point of the center of their chest, does that pain go anywhere else? Does it radiate anywhere? So an example would be, it goes from my chest into my left arm. Okay, so radiation. Reoccurrence. Does this pain, does it come and go, or is it constant? Is it a constant pain, or is it intermittent? Okay, so we're going to ask them that. Severity. In regards to severity, we're going to ask our patient on a scale of 0 to 10. 0 to 10. Being the worst pain possible, what would you give your pain? Be careful. Do not give any examples, any violent type of examples. Okay, just say on a scale of 0 to 10, 10 being the worst, what would you give your pain? That's it. Write down whatever the patient says. If the patient says 50, if they say 1,000, you're going to put 10. For time, what time did this pain start? What time did this pain start? Now, if they said that this pain started 10 years ago, we're talking about the incident right now, why we are here, okay? So what time did this pain start? Did it start 20 minutes ago? Did it start yesterday? It's been continuous. Get a time. Intervention prior to arrival. PTA is prior to arrival of us. Did you do anything for this pain before we got here? Sometimes dispatchers will tell patients that have chest pain to take an aspirin. So we're going to go ahead and write that information down and ask them, did it make you feel better? Some patients will drink water. Some patients will self-medicate with other medications. We're going to write that down and ask them, did it make them feel better? Now, this 8S means associated symptoms. So with their chief complaint that we established over here, we're going to start to ask our patient, okay, with your chest pain, do you have any nausea, any vomiting, any diarrhea, any shortness of breath? If you have another complaint, like if your patient complains of shortness of breath, we're going to ask, do you have chest pain? So we're going to ask them anything else that the patient could possibly be feeling. So for example, abdominal pain. If somebody has abdominal pain, good questions would be nausea, vomiting, diarrhea. Very common symptoms, okay? With allergies, we're going to ask the patient, do you have any allergies that we need to be aware of? Remember, people have multiple allergies, medications to food, latex, anything else that we need to be aware of. Write that down. Medications. we're going to ask the patient, do you take any medications? Or do you have any medications prescribed to you? Some patients will have medications prescribed to them, but they don't take them. So make sure you clarify that with them. So do you have any, RX means prescription medications? Do you take any over-the-counter medications? OTC is over-the-counter. Have you had recent changes in your medications? And are you compliant? You'd be surprised, a lot of the times you can find the answer right here in recent changes to medications and if they're compliant or not. Past history. We're going to ask the patient, do you have any medical problems diagnosed by a physician? Do you have any conditions with your heart, with your lung, any type of neurologic conditions, any psychiatric conditions, diabetes, stroke, seizure, any medical conditions we need to be aware of? Be careful. Sometimes if you ask the patient, do you have any medical problems? Patients will say no. However, when you look at medications, they have a list of medications because they identify their diabetes as not a problem because it's controlled. So make sure you try to clarify that with the patient because they're not aware of what you're trying to ask. Last intake. What was the last thing you had to eat and drink? Be careful. Sometimes the issue of the whole complaint could be found right here in food or drink. The last thing they had was some bad food, and that led them to have the abdominal pain in their chief complaint. So the answer could possibly be in here as well. So what was the last thing you had to eat and or drink? This is another area where I like to ask, any alcohol or drugs within the past 48 hours? Any alcohol or drugs within the past 48 hours? Okay. Events leading to the chief complaint. So with your abdominal pain for our chief complaint, that started 30 minutes ago, what were you doing? What were you doing before that? We're going to go ahead and clarify exactly. I realize we kind of got that information in here, but we're going to clarify that one more time, and this is our last chance to kind of rule out trauma. RO means rule out trauma. Okay? So I understand that you ate some bad food, but you didn't get punched, you didn't fall, car crash, fight, nothing else that can cause your stomach to hurt. So we're going to clarify and rule out trauma. Get the events leading up. Thank you.